Ever since I began my training 40 years ago, I was told it was bad to be eclectic as a psychiatrist or a psychotherapist. Eclectic is kind of a fancy word, but according to the dictionary, it means having a wide range of tastes or techniques. If you have an eclectic taste in music, for example, it means you like a lot of different kinds of music. So why is that a bad thing in mental health? In this video, I'll take a look at why something that sounds good has such a bad reputation in my field. I'm Dr. Stephen Reidbord. I challenge oversimplified, or in this case, misleading, mental health messages that you see everywhere, especially on social media. If you like what I'm doing here, please like this video and subscribe to More Than Meds. As mentioned, this isn't a new thing, but what is new are social media posts by my colleagues, highly trained, smart mental health professionals, where again and again they say that being eclectic is bad, whereas being pluralistic is good. And at first glance, this is kind of bizarre because the words mean almost the same thing. Eclectic means enjoying or using a wide range of styles or techniques, like having an eclectic taste in music. Whereas pluralism is a more political term that means favoring diversity, like a diversity of viewpoints in society. If anything, the word eclectic applies better in mental health. Therapist who uses a variety of techniques or approaches is eclectic, according to the dictionary definition. Pluralism means valuing diversity and equality, and we should value those things, of course, but that's not at all what the discussion online is about. On social media, so-called eclectic therapists are clueless jerks who pull from a grab bag of techniques and theories in a haphazard, unthinking way. They don't know what they're doing. They might try to be a psychoanalyst for a few minutes and then switch over to doing cognitive behavioral therapy, CBT, and then maybe they'll try a little hypnosis or some EMDR, maybe throw in a few affirmations. They just throw everything at the wall and see what sticks. In contrast, according to these folks, pluralism means to have a variety of techniques or viewpoints, but to use them selectively and intelligently, not in an unthinking mashup. Of course, there's a really big difference between throwing everything at the wall and seeing what sticks, and having a toolbox, a variety of tools, and selecting the right tool or tools for a particular case. The first, throwing everything at the wall, is obviously foolish and can be harmful. Whereas I'm a big advocate of having a wide range of tools and then being careful to select the right one or the right ones. That's pluralistic, according to these people online. But look, people, that's not what either of those words mean. If you have an eclectic taste in music, does that mean you listen to opera in one ear and at the same time you listen to Taylor Swift in the other ear? Does it mean you listen to Mozart for 10 minutes and then 10 minutes later you switch over to the Grateful Dead? No, it just means you like both of those things. Maybe you listen to high energy tunes during the day and you save smooth jazz for nighttime. Eclectic doesn't mean you're indecisive. It doesn't mean you can't tell the difference between different styles of music or that you make no discriminations between them. It doesn't mean you're an unthinking fool. Likewise, pluralism doesn't mean being carefully eclectic. There's nothing about the word pluralism that makes it any smarter or more careful than eclecticism. So why am I ranting about two words that you might not even care about? For one thing, because I like the word eclectic. It perfectly and accurately describes what I do. I can proudly tell non-professionals that I practice eclectic mental health care. I pull from several different psychodynamic theories when I do psychotherapy. I sometimes prescribe medications. I advocate lifestyle changes and teach people about relaxation techniques. That's what eclectic means. But at the same time, I have to be very careful not to use that word, not to describe myself as eclectic amongst my colleagues, lest they assume that I'm some kind of unthinking fool who uses all of those things all the time with every single patient. Another reason is that there are much better ways to describe and to criticize mental health professionals who practice unthinkingly, uncritically, indiscriminately, haphazardly, carelessly. There, those are 5 ways. Use those words. Eclecticism has nothing to do with it. And the third reason is that this is far from the only word that's misused to try to make a point in my field of mental health. The word therapy has been stretched and twisted to cover all sorts of things that would never be known as psychotherapy. The word that therapy comes from, I talk about that in that video right there. Trauma, quote unquote, now comes in big T and little t varieties and has been extended to apply to family and early childhood dynamics that we've known about for over a century since Sigmund Freud, but we haven't called it trauma until now because that word is commonly understood to mean something else. And I talk about that in that video right there. And one bugaboo of mine is the misuse of the word agnosia, which is hard to say, much less to spell. It's a word from neurology, the medical specialty that focuses on the nervous system, that's wrongly used by some people in mental health to describe the lack of insight or the denial of disability that some folks with psychosis have. I don't have a video on that, but I do have a blog post, and I'll put a link to it in the description. Note that in each of those cases, we didn't need to torture words to make our point. We already have perfectly good words for non-psychotherapy emotional support. Words like advocacy, encouragement, or even friendship. We don't need to stretch the word therapy to cover it. Emotional support should stand on its own without the stolen valor of calling it something that it's not. Similarly, we've known for a century that unhealthy early childhood dynamics, even if subtle, can lead to long-term problematic emotional conflicts. We don't need to call that trauma, making the word trauma so vague that it applies to everyday disappointments and setbacks. Likewise, we already knew that some people with psychosis or some eating disorders like anorexia or some personality disorders deny that they have anything wrong with them. We don't need to misuse a word like agnosia to make it sound like it's more scientific than it is, like we know where in the brain that takes place, because we don't. And we don't need to slam foolish, sloppy folks in our field by making eclecticism sound like a bad thing. It's not. I'm proudly eclectic in the way I practice. And if some of you out there want to twist that word into something bad, that's your problem. Want to hear more about the value of a toolbox, a variety of approaches to mental health care? Check out this video or subscribe and you'll find out the next time I do a video. Thanks, and I'll talk to you next time.